In this video, we will continue on our journey as a teeny tiny red blood cell. We have just returned from the lungs, which was crazy, and now we're going to be headed through the left side of the heart. You may experience some déjà vu because there are some similar structures here that we also saw on the right side. So let's get going. When the blood returns to the heart from the pulmonary circuit, it begins to make its way through the pulmonary veins. There are a total of 4 pulmonary veins, 2 from each lung, and they empty into the left atrium on the posterior aspect of the wall. If you ever find yourself in a position where you have a heart in your hands and you're trying to orient yourself, the pulmonary veins are a good place to start because they will tell you what side is posterior, right here, and which side is anterior. The left atrium is a tad different from the right atrium because it is more cuboidal in shape, the left atrial appendage tends to be longer and narrower, and the pectinate muscles are contained within the left atrial appendage. As blood leaves the left atrium for the left ventricle, it will pass through the second atrioventricular valve, often referred to as the bicuspid or mitral valve. This valve has 2 cusps as compared to the 3 cusps of the tricuspid valve. Again, this valve will serve the important function of ensuring that blood is traveling through the heart in one direction. Since the mitral valve is an AV valve, it will also have Chordae Tendinae attached to papillary muscles in the ventricle. The left ventricle will have very similar anatomy to that of the right ventricle. We see the papillary muscles, the Trabeculae Carneae, however there is no moderator band here. The myocardium of the left ventricle is roughly 3 times thicker than that of the right ventricle. This is because the left ventricle is responsible for generating enough pressure such that blood can be ejected and flow throughout the system. As the left ventricle contracts, the pressure within the chamber increases, so much so that it overcomes the pressure in the aorta and causes the oxygen-rich blood to be ejected out. Think of it as if you were in a room. That room only has 2 doors and both of those doors are locked. Then all of a sudden, the walls start closing in on you. That's going to increase the pressure in the room, right? You're going to start freaking out. Once that pressure increases so much so that it beats the pressure on the outside, one of those doors is going to slam open and you'll be free. Blood leaving the left ventricle will have to pass through our second semilunar valve, the aortic valve, in order to get into the ascending aorta. From there, blood will travel into the aortic arch and then the descending aorta. Along the aorta, we will see very specific branching patterns as blood makes its way through the entire systemic circuit. The aorta is the largest artery in the body. From the aorta, we will branch into medium arteries, then small arteries, then arterioles, as we make our way through the tissues. Within the tissue itself, the arterioles will branch into capillary beds, where oxygen gas and nutrients can be exchanged for carbon dioxide and metabolic waste. As the blood flows through the capillaries, it will eventually make its way back to the venous side of things, where the small branches come together to form larger and larger branches until we drain the blood back into the inferior vena cava, the superior vena cava, or the coronary sinus. The systemic circulation sure is a doozy if you are one small red blood cell. This is why our red blood cells only last about 4 months in circulation before they are broken down by the spleen. In the next video, I would like to summarize our journey and put everything together. Thanks for watching. For more educational videos, subscribe to the West Coast University channel below.